What is the risk of relapse with CLL?
Again, it depends on the therapy used. There are a couple of tests that you should talk to your doctor about getting that are really standard before you start treatment and at the time of relapse, that can determine, have some prognostic value. And while it's not perfect, can determine kind of what you can expect in terms of how long you'll be on the therapy, if it's something like a BTK inhibitor, or how long before, time to next treatment, how long your next treatment for something like venetoclax. These are looking really at the biology of the CLL to define like a patient specific genetics, not the genetics that they were born with, but of the CLL cells, really. So there's something called IGHV mutational status, and all of this testing can be done from the blood if a patient has detectable cells in the blood. And so IGHV mutated, for the most part, although we're learning more, generally has a more favorable prognosis or response to treatment, depending, and it's very treatment specific, actually. Exactly what you can expect, but that test should be done. Fish testing for absence of the P53 gene or deletion 17p is an important prognostic marker. There's some other abnormalities that can be tested for. And then actually DNA sequencing, looking at changes or mutations in the DNA of the CLL. And one that we know is a little bit higher risk is a P53 mutation. That's actually a change in the P53 gene. So this is definitely something to talk to your doctor about, and really standard of care to do this testing before starting treatment, and also, at the time of each relapse or treatment switch.